continue on breast cancer risk factors. Now we talk about menopause, breastfeeding, parity. Do we know the importance of menopause, parity, and breastfeeding? First of all, calm down. Don't be afraid. First age at menarche and the age of menopause are things that we can now modify, and so don't be afraid. We can now change that. We're going to start talking about our first period. We call it menarche. If a woman starts menstruating earlier, she has a longer lifetime exposure to estrogen hormone, and this longer exposure can increase the breast cancer risk. Similarly with that, menopause. Late menopause can increase the risk of breast cancer because the time of the exposure to estrogen has longer. Try to report that women that have her menopause after 55 years old have a higher risk to develop breast cancer. Now, what's about breathing and breastfeeding? Two things that affects the estrogen exposure too. Maybe we have the control of parity and breastfeeding. Women who have never had child or had women that have their first child after her 30s may have a higher risk to develop breast cancer. In contrast, many pregnancies have a protection effect. Now, considering that you have child, how time you breastfeeding? The time that you breastfeeding your child can impact the risk of developed breast cancer. But how? Breastfeeding reduce lifetime to estrogen exposure and can help that the tissues of the breast can renew. These are just risk factors, some risk factors related with estrogen exposure, but the key and keep in mind is be a healthy woman, have a healthy lifestyle, always do regular checkups of your breast. Remember, early detection can make the difference.